Hi everybody, it's Bill MacPhee with Mental Health Recovery Blog. I'm your host, Bill MacPhee, and I'm known as a recovery expert. And for all of you out there, we define recovery as when you wouldn't want to be anybody else other than who you are today. Today, May 18th, we're at the 168th annual meeting of the American Psychiatric Association. And so basically that's held in Toronto, Ontario this year. And so we're here taking in the everything, the information, and hopefully bringing you back more news and research and a lot of interesting things. However, today I want to do an interview. Today I'm with Dr. Bruno Paz Mosquiero, and Bruno is from Brazil. He's a MD in Brazil. And Bruno actually had done a poster, and basically what it is, it's a bunch of research where people do posters on research and they present them at the APA. And we were able to yesterday go and find Bruno that did a poster on the religiosity and depression. So basically, does the spirituality help you in any way with your depression? And this is very timely because, as you know, we are in a series of the Bright Future program of spirituality, and our definition of that is believing in a higher power and that God is for you and not against you. And in my case, my God happens to be Jesus. That's my faith. However, we're talking about the scientifically poster that Bruno has done. And so I'm going to ask you, Bruno, first of all, before you get into your study, what interested you with the religiosity? What brought you wanting to do a poster or to do this study?
So we know from literature and scientific interest that this is a very important subject for the patients. Many patients want to talk about their spirituality, and this may impact a lot mental health, especially in depression.
Especially depression, because as we know, depression, when we are going through depression, we see no hope, we see darkness, we have that emotional bluntness, that blandness, that lack of joy, and deep, dark hopelessness that we feel. And one of the reasons of that hopelessness is the nature of the illness, but it's a very serious illness and very serious when you're hopeless because of the suicide factors in depression. And so if if we can find our faith, that may help. So Bruno, I want to ask you a little bit about your study. Talk a little bit about the study and what you found and how you framed it.
Okay, I'm a psychiatrist in Brazil, South Brazil. In this study, we evaluate depressed patients with severe depression, poor quality of life, many symptoms, a high suicide risk, and we want to know whether spirituality and intrinsic religiosity would impact their symptoms and their quality of life, their resilience, and some biological markers also in depression.
Right. Now you're talking about the religiosity now. So what was the definition of religiosity? Explain the factors or the questions that you had to answer for what determines something to be religiosity.
Okay. The main thing we want to know is to study intrinsic religiosity. That is the subjective domain of religiosity. It talks about faith, the degree of commitment, the level of belief that people have in religious things. And it can be differentiated from organizational religiosity, that is institutional attendance to church, a temple, and from private practice such as pray, or reading the Bible, and things, meditation, all important domains of religiosity. But here we want to look at intrinsic religiosity, the subjective domain of religiosity.
So then, did you obviously you interviewed patients, correct? You interviewed people in the study, and how many people did how big of a field was your study in? How many people participated?
Okay. In this study, we have 143 patients, inpatients in Brazil, and we interviewed them in admission to the unit and before discharge. And we evaluated sort of clinical outcomes from depression, general psychopathology, social demographic factors, quality of life, resilience, and we try to know whether intrinsic religiosity can influence this kind of things.
Okay. So was there a questionnaire that the patients, the people dealing with depression filled out?
Yes.
A questionnaire? And how long was that question? How many questions was there?
We have a very comprehensive questionnaire, including validated instruments to depression, to quality of life. We use the Duke University Religion Index to evaluate religiosity, to have a very, very specific findings and to correlate in scientific way.
Great. And what was the length of the study? From what period of time, how long did it take you to gather all the information and the results and that? How long was the study?
Generally, we work in this 2 to 3 years to
2 to
collect
3 years.
all this
Wow.
information.
Wow, that's quite a lengthy study, isn't it?
Yes.
Wow. Okay, so now let's talk about conclusions. What were the conclusions? What did you find out?
We are very surprised in our results. We know from literature that religiosity is a very protective, has a very...
Very private. People are very private about the religiosity. Did you find that?
Yes. People usually, it's interesting, they want to talk about these patients, especially. But we know that religiosity in many studies has a protective effect affecting depression. And we find this in our study. Patients who report high intrinsic religiosity have a higher remission of depression, report higher quality of life, higher resilience scores, and fewer suicide attempts, a very important thing to mental health.
Right.
And the original finding of our study is that these patients with higher intrinsic religiosity present a higher BDNF, that is a biological marker that may explain why religiosity is so important to mental health and depression especially.
Tell me, you mentioned there was, I believe, 147 that you filled out the application, the study.
Yes.
And can you tell me the breakup between men and women? Was it equal, or what was, how many men and how many women? Do you know?
We have a little bit more of women.
More women? Okay.
60%.
60-40 then? Basically
Yes.
60% women?
Yes.
Okay.
Women.
Mm-hmm.
In our country are mainly Christian.
Okay.
And this is the general overview.
Right. Now you mentioned earlier about the suicide, the people about suicide, and
Yes.
now do you think that? So are you saying that maybe if somebody thought that suicide was a sin or something like that, that basically that prevented them? They had the feelings, they had the thoughts, they really wanted to maybe try that, but because of their faith, that wasn't an option. Do you think? Did you find that at all?
We know that in depression, this kind of thinking is common. It's a part of the disease diagnosis. But we think that some things such as religiosity and spirituality may help people to look at help and to deal with the suffering and to pass by these things in a better way. It can be a coping resource to deal with stress and suffering.
So would you say in Brazil, a lot of faith in Brazil, but
Yes.
within the psychiatry, within your practice and other psychiatrists, do you feel that in general it's very acceptable and okay to talk about people's faith and religion when they're coming to see you? It seems like here in North America maybe we kind of go against the theology. We don't want to hear that. But it sounds like in Brazil or in your practice that you're very well open to talking about things like that. Is that correct?
I think nowadays it's similar to the United States and North America. We are just starting to look at these kind of questions and to evaluate with patients, because it's very important for many people. In Brazil, on average, 90% of people consider religion a very important aspect of their lives, for example. So it's a very important thing we need to address in clinical practice, in mental health.
Right. So now then, so we got the conclusion, and talk about, the conclusion was clear, correct? It was very clear that,
Yes.
that religiosity helped people who were dealing with depression. Would you
Yes.
say that? And talk about the numbers there, your chart here, the scale, and a little bit about how much that was proven? Talk about the numbers.
This was a significant statistically findings. We published recently in Journal of Affective Disorders this year, and it's a very interesting find, especially because this is a very severe depressive
Chronically, yes.
With
Yes.
3 previous suicide attempts, 11 years of diagnostic.
11 years, wow. So this really was a major study then, wasn't it? Very.
Yes.
Now, okay, so then how is this practically now on a day-to-day basis when you see patients, or on a day-to-day basis, how does this research affect us in a practical way?
Okay. The first thing is that we need to look at these kind of questions with our patients. And when the spirituality and religion is a good thing for a patient, we need to address this, to help, to talk about this. This is a very good thing in this for the patients. Certainly we have some negative aspects of religiosity. This is important also, but mainly religious has a protective effect to depression, to suicide, with good effects on quality of life, well-being. It's a very interesting thing.
Very good. Well, Bruno, before we close, would you like to mention anything else or say anything else before we end here?
I thank you for this opportunity to talk about this. It's a very important thing. And to be here in North America, in Canada, it's a very good country, very good place. And I'm very happy to be here.
Very good.
Honored for this opportunity to share this information.
Very good. Well, Bruno, thanks for being a guest here on this blog, and all the best to you. Enjoy yourself in Toronto. Enjoy yourself at the rest of the show. Very glad to meet you and learn about your study. Very good.
Thank you, Bill.
Bye-bye, everybody. We'll see you on the next blog.